with 1 or 2 max.
Okay.
Okay.
The most common one. Sciatica.
Yeah, the most common one, because there are a lot of disc problems. So should I wait for Martha? Because I think, so you know what vertebrae is? What vertebrae is? What is our vertebrae? What is a vertebral column? Yeah. So vertebral column is basically for what? Like, what is the use
For the
that we
structure
have?
of the body.
Okay. Then,
To hold everything together.
yes. Okay. Then,
With the
the
movement.
most important.
The nervous system.
Okay. So, to protecting the spinal cord.
Yeah.
That is the most important thing what our vertebral do. So, we have our brain here. What is protecting our brain?
The brain.
The brain.
The bones.
What is that called as?
Skull.
Skull. Very good. So, the skull is protecting our brain, because brain, if it gets attacked from any angle, done. Done. Okay. So, skull is very strong. You know how do they do the skull surgery? Have any idea? They know.
I don't know
Yes.
the machine, but
Yes, exactly. You know the thing which you use to cut the marbles or the trees, the round one, you know, it has blades in it. So they just take that and zrrr, it will cut down the brain. That they have to use to cut this skull. Okay. हाँ, मतलब ऐसा होता नहीं है, because they know where to stop exactly.
Oh,
Yes,
that's
but then,
important.
yeah. Yeah. So that's how they have to cut, because the skull, otherwise they cannot cut. It's very strong. You know, it's very difficult if you meet with some accident to skull open. If it is open, done. But there are people who lived after the skull opens also. Very, very difficult, but then yeah, survived. Okay. So now below this, the back side. This is front side, forebrain. This is back side. What do we have here? Here we have the back side of the brain. What is that? We have a stem there. What is that? Called as midbrain, and pons and medulla. This three makes the brain stem. This is the most important part of the brain. If you get affected at this point, done. Okay. So brain starts from here, brain stem. Then it goes down. Okay. I'm very bad at drawing it, but then yeah. so, so this is our vertebral column. Okay. So we have portions here. We have portions here. The first upper part is called as cervical. The second, it's very small, it's not this big. Yeah. The second most is called as thoracic. The third is called as lumbar. The fourth is called as sacral. The last one is called as coccyx. Clear? Okay. So, why we have named it in this way? According to the position our organs are situated. Okay. So, when we see our neck portion, it only has cervical region. Thoracic is from here, like the entire rib cage, the ribs we have. Ribs for what? Protecting what? All the lungs, heart, all the lungs. So that is for our thoracic region. But we are counting on our spine. The region is here, but we are counting on our spine. Then we have lumbar, the lowest. What do we have here in the lumbar portion? The organs? The kidney. The kidney. We have kidneys here, right? Okay. Then we have sacral and coccyx. These are fused, because you know the evolution. Okay. In evolution, you know, before vertebral column, what was there? No vertebral column. And then after, the amphibians came, like crocodile, snake, and all those things, higher organisms. So they started having vertebral column. Okay, so this vertebral column, this portion is very useful for those organisms. Why? Because this acts as a tail. But then as the organisms grown, the tail started reducing. That means the sacral and the coccyx region started fusing. We spoke how many bones we have when we are born with. We have more bones. Then it fuses, and as we grow, it becomes single, right? So this portions. Now, how many bones we have individually? Cervix have 7 bones. How many? 7. Thoracic has 12 bone. How many? 12 bones. Lumbar has 5 bone. Sacral has 5 and 5. These are fused. So total this 5, no, this is 4 and 4 basically, but sacral has 5, I guess. It's 5 and this coccyx has 4. Any of it, this has 4. I think this has 4 and this has 5. Okay. So overall how many? It should be somewhere 33. Right? Just count. 5, 5, 10, 10 plus 12, 22, 22 plus 7, 29 plus 4, 33, right? Yeah. So, but the nerves coming out of it, the nerves. Now, I am taking a short portion. For example, we are just going to talk about cervical. How it will be. One bone like, oh, look at this. Mangoes. No, it's not mangoes.
No?
No. That is not.
No, it's gone.
It's not mangoes.
So what is it?
It is peringyai, like it drills under the ground. One bone. Now, how it looks? It has spikes. From here, we have spinal cord running. This is our next bone. In between, there is a gap. This is called a spinal disc. Okay, this is called as one bone, this is called as two bone. For example, this is C1, this is C2. Now, the spine is running, that means the nervous system is running parallelly to it. There are nerves getting inside this, into the disc, so that the message, why we have neurons here? Why do we need this nerves here? This is our main CNS. The entire peripheral nervous system, sensory, everything goes to this place only, right? This and this together works as our CNS, central nervous system. You remember? Right. So, we have nerves where sitting inside this vertebrae. This vertebrae is basically protecting this nerves. Clear? Now, we have muscles attached to it. How many muscles? Lot of muscles, full of muscles. How? The muscles, the ligaments attached to these portions, the muscles around this, the muscles which are pulling this, the muscles which are pulling both of the sides, the muscles around this again, the muscles who are pulling this, the muscles who are pulling this in this direction. So, every vertebral column is full of muscles attached to it to different directions and inside this also. Clear?
Ligaments will be in a
Ligaments are nothing but the connections of this these are bones, right? So, bones and muscles has to be connected, right? And muscles inside that muscles should be connected. Muscles cannot directly, big muscle cannot connect with a smaller one. So, both of them should be connected. So, the bones which are getting connected to the muscles and the muscles to the muscles, they are all these ligaments and tendons. So, we have lot of ligaments connecting these muscles and bones together. Clear? Okay. Now, as I was mentioning, we have spikes. These are again connected to different places, you know, because it cannot hang. So, this actually helps everything to be protected, because if it becomes a small complete round, it cannot protect entire spinal cord. Spinal cord is very important. Why do we have this? This do not contain spine alone now. This do not contains the blood vessels alone. This has a fluid inside. What is that fluid called as? I was mentioning one day. CSF, right? Cerebral synovial fluids, right? So, we have a fluid in the in between the brain and the skull, and in the vertebrae and between the spinal cord.
So brain always has a that's a fluid also, right?
Always. That is the fluid which comes out of the ventricles. There are some ventricles, okay, in our brain. Ventricle produces and makes this fluid. This always squeezes out and it gives a cushioning between the bone and the muscles of the brain. You are clear? Getting my point? Why do we have this fluid? Now tell me the use of fluids.
To
Make a mobility.
Mobility of what? No, it gives a cushioning effect to the joint. Mobility is due to muscles. Mobility is never due to the fluid.
so it's make
Lubrication, very good. Then not to not to generate friction.
So mobility always in a muscle.
Muscles. Mobility is always related to the muscles. The fluid is for the cushioning effect. If you get hit, the thing which is going to protect you is the fluid. Then second major, to provide the nutrition. They have to circulate the nutrition, right? It is through the fluid. Okay. Then lubrication, which gives the bones and the muscles the watery content in it. So the fluid is always there. Clear?
So this fluid is, again, can you say the name?
CSF, that is cerebrospinal fluid.
Cerebral.
Do you want me to write it? Okay. Yeah, you have a structure here. See,
Cerebral.
from the down, like from the upper portion of the spine. This is how it looks. There are spikes. There are spikes, and then this is spinal cord, and this is my
There are the nerves, right?
yeah,
Running
yeah,
in there.
yeah, like running like this. Getting? Yeah. This is intervertebral disc, right? This is intervertebral disc. This is disc. Through this, it is crossing. Clear? Yeah. So, coming to the sciatica. Coming to the sciatica. What is sciatica here? Okay. Now, how many nerves we have here? Cervical. We have nerve here. It always, in cervical region, it always, the nerve starts from the down and we name it as 1. Like the 1, the C1. So, we name it as C1. C1. The C1 means cervical number 1. Okay. We have a neuron running from down here. It is called as C1's first neuron. Neuron. This is bone, right?
Yeah.
This is neuron. Any doubts? Yeah?
Neuron. You're
Nerve, nerve, nerve.
because neurons are the cells that send the
Yeah,
message.
yeah. So neurons are the cells, nerves we can call. Okay.
Okay. Okay.
But why we call it in nervous system? We always call them as neurons, like in general words. Everybody use that neuron. So whenever they are using its neuron, you just get it. Okay, it's a nerve.
It's a nerve.
Yeah, nerve cell or neuron. Both are same.
But
So-
there is only one.
This one? No, it is the multiple layer of neurons.
Okay.
Lot
so
of neurons
many
will be there.
nerves.
Many nerves it can be, or multiple neurons. Many nerve makes multiple neurons. Multiple neurons make one single nerve. Clear?
Okay.
Don't get confused, both are same. It's a higher version, it's a smaller version. That's it. So we have a nerve running here, and now C1 it is called as. Now second is C2, which is running below the C2. But in C7, what happens when it comes to C7? This is C7, right? C7 joint. and the nerve which is here is called as C7. But the thoracic, it also we count it as from T1 it goes up. So from T1 we count it, sorry, I'm so sorry. The cervical has its nerve on the upper side. The cervical has the nerve starts from its upper side. Once it comes, there is a joining between C7 and T1, right? The T1 starts it now from the downside.
So which one is in between them?
What you tell me which one will be? This is C7 ending here.
C8.
Yes. So we have a C8 nerve here. When it starts from here, it becomes T1. So how many bones for C? 7 bones. But how many nerves? 8. But remaining everything has 8, same number of nerve as well. For example, T has 12 joints, means nerve will be 12. Lumbar, 5 means nerve also 5. But in the C7 means cervical, we have 8 neurons, 8 nerve cells. Is it clear? No.
Always on cervical nerves are above. Yeah.
Yeah.
Okay. And so the last one.
You draw it by yourself.
There is just one
You
more.
draw,
There is just
no,
one-
wait, don't get confused. You don't have to get confused anyway. You draw 3 cervical and 3 thoracic and name them. Name them in your note.
Okay, I understand.
Do it.
So yeah, well, one, two, I understand. Then there is one C7 above the C7 vertebra, and then again one C8.
Yes,
That's it.
down.
Okay.
So, next one will be T1, right? T1 comes where? Below the thoracic. Below the thoracic joint. Is it clear? Any doubts till now? No. So, it is done. So, what is sciatica? What is sciatica? Sciatica is when we were mentioning about the what? Bones here, right? So, we have bones like this, like this. Now, we have a disc here. What this disc? This disc is full of lot of blood vessels in it, lot of nerve tissues in it, lot of adipose tissue in it. Adipose is fat, lot of proteins in it, right? So it overall gives a cushioning liquid, semi-liquid thing. Now, what happens? In sciatica, this liquid has the problem. Either it just squeezes out, that's called as disc bulging or disc prolapse. What happens? It squeezes out. The entire liquid comes, but the nerves cannot come out. The blood vessels cannot come out. What will happen to them? They'll remain there. But because the liquid has come out entirely, the cushioning thing has out, these things get closer.
There is the pressure.
Yes. There is a pressure on what?
On the nerves.
Yes.
But
That-
that disc is fused then, right? No fusion.
Whatever I am telling, just listen to it. We'll ask all the questions at the end. So, that is the first condition when the liquid is coming out. First condition. Second condition, the liquid dries up. Okay? The problem is with the liquid or the protein cushioning dries up. The third condition is there is a dislocation in the spine. For example, my spine, my vertebrae has to just sit above this, but it just shifts its place. It moves like this and it moves like this. The cushioning effect twist, the liquid is still there, but it dislocates.
Okay. So, how do you call that?
Dislocation, disc prolapse, this all comes under disc prolapse. Disc prolapse means the prolapsing of the disc, prolapsing of this part.
All these cause of sciatica is already
No. Just listen what I am telling, no questions right now. Once it is finished, you will understand where exactly where we are going. Okay. So these are all different conditions. Clear till this? So disc prolapse, we have different terms for different conditions. Have you heard about scoliosis? Yeah. What happens in that? The cervical, this thing becomes either S shaped or C shaped. What happens in that condition? Dislocation. The condition is different, but what mechanism is happening like this? Getting? What else I have to? Another condition called as stenosis. Stenosis, this is scoliosis. In stenosis, what happens? The bones themselves get diffused. Okay, there is not much strength for the, it gets smaller one. Then what happens? Again, the effect is going to be on the disc, because this is getting damaged, along with it disc also get damages. So it may fuse, it may collapse, or it may collapse in the sense they just join it, or they'll be just compressing the nerve. Okay. Now, according to the place where this disc are making this thing, that position is called, is related to that. For example, I say scoliosis of cervical, that means in cervical bones scoliosis might be happening. If I say that thoracic, that means in T12, out of any T12 it may happen. Sciatica happens either in the lumbar region or in the sacral region, mostly in the lumbar region. It's the down condition. The same condition happening in the lumbar region is specifically termed as sciatica.
So sciatica is in the lumbar region, and the same phenomenon, the disc reduction, is called.
No, it can be anything. For example, scoliosis is not the same condition. The scoliosis is making the changing of the spine itself. Sciatica is, it can be because of the disc prolapse, it can be because of the change of the shape, it can be because of the reduction of the disc, the space, it can cause anything, because it is causing in the lumbar region, because there is a nerve which is running from in between, they are called as sciatical nerve.
Ah, yes, okay.
When you have a problem with sciatical nerve, that is called as sciatica.
ये posterior side anterior side बता दीजिए ना मेरे को.
हाँ, ये जो है फॉर एग्जाम्पल पोस्टीरियर इज बैक साइड.
Anterior अंदर का रहेगा.
इफ वी आर कटिंग, हम बीच में से काटेंगे तो पीछे का साइड पोस्टीरियर, एंटीरियर इज द फ्रंट साइड. तो मान लो कि मेरा ब्रेन स्टेम यहाँ पे है, तो ये मेरा पोस्टीरियर साइड है, दिस इज माई पोस्टीरियर साइड. इफ माई फोर ब्रेन इज हेयर, दिस इज माई एंटीरियर साइड. क्लियर? ओके. So don't get confused in anything, just be in a pattern. Okay. Now, what do we have next? Yeah. So, during sciatica, what can happen? Okay. Okay. Sciatica now can have, because of so many reasons. Condition is this, so many reasons sciatica can happen. The first is herniated disc. What is herniation? What is herniation? Nothing. Herniation is whenever you have a protrusion outside the body, anywhere in the body, and there will be some fluid accumulation. That is called as herniation of that part. That is called as herniated. So whenever the herniation is happening in the disc, it can cause sciatica, because the entire liquid is pushing out of this disc, right? Every liquid is here. Now there will be a closure of vertebrae and it will be pressing my sciatical nerve. That is called as one condition.
If that disc is getting compressed, the liquid will come out, right?
Yeah, this liquid can come out. We are not talking about in what condition it happens. We will talk it later. Okay, we are just talking what is mechanism. Yeah. So the liquid is coming out due to some reason, and the vertebrae is getting closer. Because of that, there will be a compression in the sciatic nerve. That can be one condition. So this portion is coming out. There is a hernia of which disc. That's why called as one condition can be herniated disc of the vertebral sciatical nerve. Clear? Any doubts?
Can be, but can be also in other.
It can be.
in all
Don't get
the
confused. It is one of the reason.
that's why
Just
I
one
asked.
reason. Yeah. Never conclude in medical terms. There is nothing called as one reason. Any disorder cannot be of because of one reason. It depends on person to person. It depends on the conditions. It depends what exactly happening. But the ultimate result is the sciatical nerve is getting compressed. Whatever is happening because of sciatical nerve is going to get compressed. That's why I am going to have sciatica. It can be of different. That's why we take different scans.
But my question
Yeah.
is, can we have hernia in any? We can have this
Yeah.
hernia anywhere.
Yeah. But we are not talking about that part because we are talking about sciatica right now.
Okay, okay, but just to understand what
Yeah.
is hernia. And
Hernia
if
you
we
can get
have, yeah.
any, because any disc can have hernia. Not only in the disc, you can get in any body part.
Yes.
Hernia can be in your small intestine. Even the males get hernia in the testis also.
Yeah.
Liquid deposition, and all the fluid whichever is regulating there will be depositing in that. Here, because it's CSF, so that's why CSF is going to deposit in this condition. Or maybe some other liquid also, like you say fat cells or something. Is it clear? Fluid accumulation. Any doubt until then? What happens? The bones can be overgrown. So what happens? Where it will grow? It has a specific area only. So it may go inside, it may grow inside, and it automatically pushes the disc, sciatical nerve pressed, compressed. So overgrowth of bone in certain condition.
What do you say that mean? It is over when it's over comes into organ.
So because of high glucose in the blood circulation, it starts getting deposited. So very rarely, but that can be a cause. Okay. What are the reason? What are the causes this herniation itself happens or the bone damage may happen? The first condition is age. Age. Why?
It's getting used.
Yes, very much, very good. Because of the age, your fluid automatically reduces because you are using it less, it is already dissolving. Okay, and also with the age, your bones get porous, your bones get more defective, right? And also the muscle system, if you are not using it, the holding of this bone will be reduced. So what will happen ultimately? This is collapse or it joins.
Spasm or something.
No, 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 that is different. That is different.
So it's called a degeneration.
Degeneration of the bones. Yeah, that can also happen. Then, second condition is obesity. If somebody is obese, they have high chances of getting sciatica. Why? Can you tell me the reason?
A lot of pressure. No?
A lot of weight, the body, the spine has to bear a lot of weight, and for the obese people, especially what happens, this vertebral column, first muscles are gone because they are not active. Then second is their heaviness in the adipose tissue. They have very heavy adipose tissue. So the entire thing which is bearing is our vertebral column and the legs, right? Legs, we have less joints, but in vertebral columns we have 33 joints. Okay, there are three types of joints. One is unmovable. Tell me one unmovable joint. No, it is movable. No, that is also movable. Unmovable, have no motility at all. Okay, that is in our skull. Our skull has a lot of bones and they are joined together with sutures like this. This is my skull, one portion, second portion, they are like this kind of, you have seen the threading, right? Thread we do, huh? That's how they are joined together. They are unmovable. Our skull do not moves. Joints. Okay? They are called as sutures. Then there are partially moving. Partially moving is spine. They are partially moving. The joints are still there intact. Okay? But the mobility is like this. That's it. They are completely moving. The joints, which we have 6 types of joints, including synovial joint. It is lot of they are called as mobiles. They have a high mobility. Okay. So vertebral column has to move a lot with lot of joints, right? Yeah. Then the third condition is the person is according to the person's occupation. For example, a person who is standing for a long time, teaching, conductors, you know, and or else where they have to stand and work. The person who is sitting for a longer time in front of their system, computer, they are not moving at all. So in that condition what will happen, this particular parts get, especially the vertebral column starts getting damaged. First. Second, few people have a, now these days everybody works with the system, few people works like this. Scoliosis. They have a hunchback. Why? Because they automatically, they are so much concentrated, they don't realize they are bending and seeing the system. So they'll get a hunchback, scoliosis in. So the entire thing will be turned. So how you should be keeping the system in front of you? It should be straight to your head level, eye level. Your hands should be resting on the table. It should not be like this or like this. It should be properly resting. The legs should be properly bent and perpendicular to the ground. That's how, because in the longer run, you don't know. If you are able to fold your legs and sit, it's very good because still you are towards the gravity. Your legs are towards the, and they may have a chances of getting varicose veins also. So it's better to fold in a condition where you can fold and set straight, system in front of you. Clear? Otherwise, you will end up having sciatica, scoliosis, herniated. Spondylitis. We are going to talk about a little bit cervical spondylitis. Spondylitis is again the damage of the disc due to certain reasons, like you are making your neck in a certain condition where you are actually accumulating fluid in the discs of the cervical region. This time this is cervical region spondylitis, or thoracic spondylitis also happens, right? Okay. So also in the pelvic region also spondylitis happen, okay, pelvic bone. Clear? Now because of the occupation. Then third is prolonged sitting, I have already spoken. Then the condition of diabetes. If somebody has diabetes, they have high chances of getting, food is very important for the sciatical patient. If you are not having sufficient food, then it is going to affect you. What are the food we need to provide is, first food is, it should be highly rich in very good, lubrication must be there. So the best food for the spondylitis is ghee. Ghee. Exactly, lubrication. So you have your joint pains, you have your sciatical pain, have tremendous amount of ghee. Okay, not ghee. How do we diagnose it? Okay. So if some patient you are getting, How you are going to diagnose that this person may have sciatica? The first thing he'll be coming, sir, I have a knee pain. How you are going to diagnose it? Come on, come on, come on. Now you have to tell. You are in 2 days you are becoming yoga therapist. You have to do the diagnosis.
Actually, like,
You have to identify. How do we identify it?
Collapse of the marrow.
Sorry?
The collapse of
Disc prolapse also can cause just the disc prolapsing.
the marrow coming out.
Yeah, the marrow, it's not marrow, it's the CSF or the adipose tissue. First diagnosis. Now, how to identify? Particular nerve of the body, as I said, it has a particular pain. Along with that, it has a particular function also. For example, if I ask you to do a particular thing and you are not able to do, that means this particular nerve is affected. Clear? For example, she said she has a pain in elbow. Okay. If she is not able to turn it in a particular angle, we can identify which nerve it is, which point it is coming from. So, in sciatica case, in severity of the person will not be able to walk in the toes like this. He cannot, because that function is done by sciatica nerve.
So on the toes, they cannot
Yeah,
walk on the
not toes, like even on the complete. This is heel, right? No, this is this no, toes and this part. No, completely in like front toe. They cannot walk. They cannot walk like this.
that's so. Okay.
No, you don't have a severe. You don't have
Also, they will have a problem with squatting. They will not be able to do squat properly. Squat, which we do squat, right?
Yeah. I'm thinking about my kids.
Simple thing. They cannot sit in the ustrasana. Oh, not ustrasana, utkatasana.
If I knew which one it was.
Chair pose.
The chair pose. Yeah. Utkatasana. If it is so, according to the way they are bending, we can know the severity. If the person not at all is doing, it's very severe. If they are able to do up to an extent, they can. Yeah, it's fine. Still sciatica, the disc prolapses. Now we can identify where our vertebrae is, right? If it is completely compressed, done. If it is just compressing, you can identify with the position of the person where his vertebrae is right now. Clear?
So impossible to stay on.
Another test called as, they have a hammer kind of thing. Physiotherapists or doctors, they have a hammer kind of thing. What they'll do, they'll touch it. The same test is done for the identifying the reflex also. People lack their sensory nervous. Yeah, they'll just touch it, whether what you are doing. Hammer kind of a thing. They'll just, do it, and they'll ask you to detect the pain, how you are identifying it. They have, and for checking the reflex, they'll put some needling kind of things just near to it, and how frequent you are pulling up your leg or hands. That's how they do the test. Okay, so they'll just check through that also, which
sometimes they put also on the knee, right? They sometimes
yeah, for checking that what is the pain radiating,
that is
checking the
for
pain,
nerve only, right?
nerve only, the reflex or the nerve, whether the nerve is working or not. Okay, then going to the higher. Once they confirm it, okay, this person has some problem. Now comes the instruments. We have lot of scans. Starts with X-ray, this common one, basic one, goes to MRI, fMRI, okay, and they have a lot of magnetic. So the instrumentation is a total different portion. So we are not getting into it. Okay, in instrumentation, They identify the prolapse exactly, they see in the scans or the results they get, where is the prolapse exactly happening. They can see, the people who don't know, we feel like everything is same, but then they can identify because of the distance. For example, there is a disc prolapse, the white part will be more because the light's rays cannot pass through that part. It cannot penetrate, or it can penetrate. So, it will not give a visualization like bone. Bone are heavy. It can, there are different types of rays, alpha, beta, gamma. Have you heard about it? Okay. So, everything has their own penetration power. So, X-rays are the one which penetrate, which cannot penetrate, and it gives the image. So, more it goes, like alpha, beta can penetrate a lot. You have heard about radioactive activity, radioactive substances and all those things, uranium and all those things. That thing can penetrate more. More penetration, more damaging. Less penetration, less damaging. Clear? So, we have a range called as wavelength range. This is called as spectrometer. Spectrometer, okay, we measure it through spectrometer. So, we have like lot of range. The last, have you heard about Vibgyors? Vibgyor is white light. It falls from 600 nanometer, 400 nanometer to 800 nanometer. There it's IR, infrared rays. Here it is UV, X-rays, alpha, beta, gamma. Alpha, beta, gamma. This is how the wavelengths are. It goes high to this side, goes low to the this side. Don't get confused with all these things. I am just telling you, it is a very common thing which you have to understand, that there is something called a spectrum, light spectrum. Okay. Then the last is microwave. Have you heard about microwave? Microwave. What do you want to cook? Oven you are using. Microwave. X-rays, beta rays. You have heard about when you cross this airport, you have to scan detecting. That works on, yeah, that works on a different particular of the light which we see, that works from 600 to 800. We cannot see beyond 600, beyond 400 and beyond 800. Getting it? So, but other, I told you some animals see in UV radiations. For example, eagle. You have seen eagle? Eagle. Eagle can catch the things which is very far from it. We cannot see that, right? They catch it in a different IR. They catch it in a different wavelength. For example, snakes, they catch it in IR. Why? Because they have to see in the night.
Also bats, no?
Bats.
Pretending.
Bats do not see. Bats
Yeah, that's
only
the way it's
sonification. That is through the sound. They can only see in the night, little bit light, white light, it will damage its eyes. They get this thing. They can only, their eyes are made for the night. So, they also work in the eye. With that, they work on the sonications, the sound.
All also like it. Ullu.
MRI or X-ray in their hand that you have a disc prolapse or you have a sciatica. Now, what's next? What's next? Really? Doctors make you run away? What's next? Treatment, guys. What next? It's treatment, right? Please answer, please answer. What kind of treatments can be given? That is our yoga treatment. Other than that, what are the other treatments can be given? Because tomorrow when you are going to take your presentation, you have to mention all this. How do you identify? How do you diagnose? How do you give the treatment? Day after tomorrow you have a presentation, right? About some disease.
Like,
Like anti-inflammation. Yeah. So anti-inflammations, okay, sorry, muscles, narcotics. Okay. So anti-inflammatories, what it is going to do? There are a lot of anti-inflammator that affects in the immune system. Immune system means the inflammation should not be there, because inflammation itself causes a problem. It's a symptom I said. So what people do, what the drugs first do, anti-inflammation, don't coagulate. So it will prevent you from the hernia or the disc prolapse. First thing. Second are the narcotics. You know what is this narcotics? Yeah, it's a drug, but then why it is used? Have you heard this narcotics?
It's you said it the other time, right? It's for the neurons to basically make them sleep.
Yeah,
That's what you said the other
yeah. So what does this narcotics does? Have you heard about narcotic drugs which are banned all over? They just check, you know, no, ban it. What are this? These are neuroblockers. Neuroblockers. They block the functioning of the neurons, right? Then we have working on the muscles. For example, I have this muscles which are getting contracted. I can physically give the drugs which can make it contract and relax. I give those drugs. Then I have antidepressants or anti-seizure medication. This, what do you know what is seizure is? Epilepsy. Epilepsy. What exactly happens in the seizure? Okay.
वो ऐसे गिरता है वही वाला
Fits. People having fits you have seen.
Yeah.
They have this white thing coming out of their mouth. Yeah. What is that? Actually, what happens? We have in nervous system, we have a pattern of pathway generating. Okay, we have a pathway. Like at a particular time when we have to work, this pathway should be active, other pathway should be suppressed. What if every pathway gets activated all of a sudden? Boom, over. That is what happens in the seizure. Every pathway gets activated. Dum, dum, dum. The body doesn't know what to work on. Seizure. So they give anti-seizure because it is again the depressant, again the suppressant of the neurons. They have an entire pathway. I am not getting into the pathway. We are now making neurons not firing anymore, not working anymore. Clear?
The anti-inflammatory medicines.
Yeah.
What do they do exactly?
Clotting or WBC, anti-allergic, what they do? They stop the reaction. They stop the reaction in the immunology. They stop the reaction in the blood level. So the inflammation will not be there.
So when you have, for example, a headache,
Okay.
right, and
You take pain reliever.
oh, it's not an anti.
No. When you have a pain, because of that you have an inflammation, you take anti-inflammation. Pain causes inflammation. Inflammation is a symptom. Inflammation is not the problem.
And the painkiller, what?
Painkiller, nervous system. It stops working the nervous system. Inflammation is different. Anti-pain is different. Clear? Anti-pain act as the pain reliever, acts on the nervous system. Anti-inflammation acts on the blood system.
But it's not the solution, right? Because
It's not
you
the
said you
solution. It's a
cannot heal.
temporary. It's a temporary pain. If I am getting a pain, the pain is due to some breakage. But what I am taking, I am just numbing my nervous system to not give my reaction of pain. Pain is not there. But it doesn't mean that the breakage is not there.
But this is just in the case when
Severe pain.
So your question is what is the long-term treatment? Yes?
I have not got into it.
Okay.
I have not got into it. That is non-pharmacological treatments.
Okay.
In sciatica, long term, if it is goes, we have not got into it, we are learning it. So physical therapies are there. What are physical therapies? Give physiotherapy, give massage, give yoga therapy. These are the long term effect. Okay. So the depressant drugs which we are taking, they are short term, just for the symptom relief. But
this is like the yoga therapy and the physiotherapy doesn't make the fluid go back again, right?
it
It's
can,
just- yeah?
it can,
Okay.
depending on the severity. If the fluid is not there, it cannot. If the fluid is there, it's just prolapse coming out. There is a chances it can push it back.
Okay. And also like when it's I just wrote it in German. I don't know when it's
Yeah, deformation,
deformation. Yeah.
it can fix it.
Okay.
Lot of people in scoliosis and all these things, their S shape becomes straight, their C shape becomes straight, their hunchback becomes straight when yoga therapy is given. Even lot of physiotherapy can do that. But physiotherapy,
Osteopathy.
yeah,
Osteopathy is working with
osteopathy is different. Osteoporosis is different. It is the breaking. For that, you cannot fix it only with the yoga. You have to take the intake also, the food intake.
No,
She's
but
talking
because
about the osteopath, the guy that...
Steroid medications also. We have steroid medications also. So there are a lot of steroids are lipids again. So this affects our hormones. So steroids are not good. But then pain relief, you take steroids, you will have, after sometimes the neuron starts dying, and you will have, for the temporary solution, if you are pain radiating too much and you cannot bear it, then you take steroids. That's how patient take. Okay, but it's very long term, it's very bad. Then the final stage, not at all, nothing can be done, surgery. Surgery is very riskier in this case, because once you touch the spine in surgery, anything can happen. So nobody takes the risk normally, because surgery, they just do this, insert all these things inside, put it on the space, seal it. That is what normally has to be done in the surgery. That is what they done. But the patient may have paralysis, coma or anything, because it is too riskier to play with the spine. Okay, so it is better to do yoga. So now we are coming into the Ayurvedic aspect of it, due to Vata. Bone has the Vata, right? Anything increasing in the Vata causes joint pain, vertebral pain, any problem completely. Okay. So what are the foods we are going to have here? We are going to protect our spine, we are going to protect our joints, we are going to protect our muscles. Food, ahara, tell fast. What are the 3 tastes we are going to increase?
to reduce vata.
Yeah.
So
To reduce the vata, what we have to increase here?
We have to increase the, no, kapha. Kapha, the first thing is madhurahara has to be increased. So the people has to eat more sattvic food. In modern science, what we have to eat more? The amount, the thing which contains more calcium in it. Calcium in it. And along with that, we have to change the lifestyle. Lifestyle will come, okay? Madhurahara. Then second is amla.
lavana.
Amla and lava. Right. But
What is sour? Sour is amla.
amla is, lavana is salty. So we are going back to this vata. Tikta increases vata. Kashaya increases vata. Katu increases vata. So we are going to reduce it, right? Katu, tikta, kashaya. Then amla decreases vata, madhura decreases vata, and lavana decreases vata. We are going to increase that. Okay. But the person who has pitta along with it, pitta, we cannot give lavana, because lavana also increases pitta. Right? Pitta is body heat temperature. If you have joint pains and body temperature together, then you cannot increase the lavana. Then you have to stick only to the madhurahara. Okay? Madhurahara, satvikahara with calcium intake. What are the calcium intake thing? Milk, very good. Then, very good. Okay, what is the one thing the milk do not contains?
Sunlight.
What?
What is the one thing, very important thing in our diet, milk do not contain? If a person is drinking milk all the time and they are not taking any nutrition, they will be lacking one nutrient, which means it is very important, but we cannot get it from milk.
Vitamins.
What is that? Just tell me. It can be anything. Just tell me one thing which we do not get. No, vitamin D. Okay, fine.
Ah, okay. I was not
Other than that?
pronouncing correctly.
Other
I
than
was
that,
saying
no. Vitamin D is common.
you were understanding which means, no?
Vitamins, yeah. But that is not a thing which I am asking you.
Okay.
Which is very much necessary for us? Yes. Iron. You cannot get it from milk. Okay? You have in many things, other things, but every component other than iron, this milk has. Getting it? Clear? Okay.
Iron you get from by leaf.
Leaves. Yeah. Any fruits? Pomegranate has high iron, amla has high iron, and along with the calcium, gooseberries, very good for your bones.
Okay.
Which one?
Gooseberries.
So we need iron
Amla?
and calcium.
Calcium with the milk, but we lack iron there. We need iron from amla, pomegranates, leafy vegetables,
Broccoli,
broccoli. Broccoli has a lot of proteins as well.
chickpeas as well.
Can I ask
Chickpeas, yeah, protein, yeah.
Madhura Ahara?
What are the viharas we can practice for this? Ahimsa, satya, asteya, aparigraha, brahmacharya, all we can follow. The main thing is ahimsa we have to follow every time.
Swadhyaya also?
Swadhyaya is to understand yourself. Swadhyaya, to learn yourself. So basically, Patanjali what says, like Swadhyaya can be of two different. One is learning from the literature, learning from the guru and everything. But Swadhyaya is learning yourself. It is one of the niyamas. In that, you sit and you learn your body.
So you don't suggest on that?
Yeah, it is suggested. In yoga therapy, the best thing for Swadhyaya is you sit and you identify where your pain is. How to apply Swadhyaya in yoga therapy I am talking about. You understand where your pain is, okay, and you heal that pain. How? To applying yoga therapy to it. You understand the pain, from where the pain is coming, how it is radiating, what is causing the pain, and then you learn which stage you are.
That's the doctor that would be with myself.
Okay.
What your doctor said?
No, I said like this is what I would love to understand and to learn.
Your
And I
doctor
said,
was
okay.
asking me, how's he doing and something. I said, you are a very nice person also to teach Ayurveda. And he is saying, yeah.
Yeah, but he knows because I talked to him about her.
Yeah. And I was trying.
Yeah. What kriyas can be given? To function, the joints. I have not spoken to you about the knee joint at all, synovial fluid, okay? It's very important to know the synovial fluid, but I don't have time. But you have to, if possible in future, please read about the synovial fluid because it's very important. Very important means very important. Whatever joint problem you have, it starts with the knee. Which kriya is the best kriya?
I don't know in this case.
Think. Vata. You have to connect it with Vata. Yeah.
So to reduce vata, we have to do basti.
Basti is the best one. Why? Because Basti is the one which reduces Vata to the core. So once you have any joint problems, any spine problem, immediately the Ayurvedic doctor suggests you to take Basti. They'll tell. Basti is good for Vata reduction. That is Ayurvedic treatment. That is not yoga. Ayurvedic treatment, they lubricate it with lot of oilation because no, that is abhyanga. The oilation, the massage part is called as
They
abhyanga.
make with this dough and they make on the dough.
That is oilation. That is also comes under the panchakarma treatment. That is not basti. Basti is the specifically cleansing of your small intestine. Yeah, there are a lot of panchakarmas, nasya, then this one virechna, then basti, then you have this for head you have there are 5. Sorry, Shirodhara you have. So they make this dove out of urad dal. Urad dal is black grams. They make it a paste. They put it wherever you have the lubrication problem. They put it the round. If it is on the head, sometimes they make the eye, they cover it, and then they put a specific Ayurvedic oil to store there. Yeah, so they put it there and they keep it there so that everything will be absorbed into the joints. Then
Why did you mention the water? You said basti is the best because of the water in the joints. You mentioned
fluid in the joints.
Sorry?
Fluid in the joints.
Fluid.
Yeah. Basti is not mentioned for that, but Basti is for reducing the vata.
Ah, it's a pattern.
Yeah. Okay. Then what kriyas? Other kriyas? Any other kriya?
I don't know. I don't see why. Like I don't know. Proceeding by elimination because I don't know what other one.
Okay.
Like I don't know what Kapalabhati can be.
Kapalbhati can be given. Exactly. Why?
Because it will stimulate your nervous system.
The Kapalbhati is very good. Kapalbhati can be given for all the tridoshas. Actually, all the tridoshas can be, but kapha is the most important thing. I told you there are a lot of disorders. Out of kapha we have 20, out of pitta we have 40, and out of vata we have 80 disorders. But Kapalbhati can be anything which is related to kapha dosha.
But can you, except through this Kapha-Vata approach, can you explain why Kapalabhati is good in this sciatica case?
Okay, it's because the joints, okay, we have,
If it's too complicated,
no, it's not complicated. I was actually about to explain you yesterday.
So then through Ayurveda,
Yeah.
Vata, Pitta, Kapha.
Everything tridosha,
Okay, so just
yeah, through Ayurveda. Basically, we have 7 dhatus. So, asti is one of the dhatu. Asti is the bone. Majja is another dhatu. Majja is bone marrow. Meda is another dhatu, that is adipose tissue.
okay. So well, my question was actually.
What are the asanas can be given?
Um,
First we categorize it to 2, okay. First is strengthening, second is, the best is back bending,
Lengthening the spine.
lengthening the spine. Very good, tell.
Paschimottanasana.
Paschimottanasana, I'll keep it here. Contra, okay, before that I'll tell you. Contraindications, forward bending. Why? Because this sciatica, this is the spikes. Most of the time we have the human spine has a condition, it can bend like to 180 degree exactly in the forward direction, but backward we have a limitations. So, most of the time we do not do back bendings, we do forward bendings. So, the disc prolapse or hernia which happens is towards the opposite side,
What does it mean towards the opposite side?
where we are bending to the opposite
Because
side,
this way
because
instead of
we
this way.
bend mostly to this direction. So, this will happen on that
You
direction.
bend in the opposite direction of where the hernia is.
So, when we, most of the people, because of the sitting and everything, it goes like this. Now, what you have to do is, this is anterior, this is posterior, okay. And now, to make it push inside, we have to bend backward. It should go inside first. Second, lengthen the spine. On the basis of that, you are going to construct your asanas, okay. Straighten it. When you straighten it, the disc will automatically be making more space in between the sciatica nerve. Wait, let me finish this first. So, first is this, second is this. Third is, you make your core strengthened. Core strengthened. Why? Because every weight, until my core is not tight, every weight will be going to my spine alone. But when my core is strengthened, my muscles of the cores are strengthened, so what I am going to do is, my weight will be equally transferred to my core muscles as well. Okay. Now, every muscles of my spine are only getting activated at a particular point. I have to activate other muscles as well by prolonging it, so that my other muscles also can have the weight bearing. Then stretch it backwards, so that my spine gets more strengthened and my disc get more tightened up. The muscles around it get more tightened up. Also, the core strengthening. So, these are the 3 things you have to keep in your mind and tell the asanas. Your question?
I mean, I don't understand if the prolapse is going, this is backwards, right?
Yeah.
Posterior.
Yeah.
If it goes out,
Yeah. Yeah,
Whereas the
yeah,
posterior
yeah,
side,
yeah.
why do I have to bend that way
Outside,
on the
so that it can
pinch
go
it?
inside. It can go, it do not starts like it is just out here. It starts from here, starts from here, starts from here, starts from here.
And this way it's not going.
When you are bending here, it should push this to that side. The pushing is that side. Why it is coming out? Because the pushing is towards this side. That's why this thing which is inside it, it is going. When you are bending down, the thing is going to push it that side, another side. So the thing which has come out will start going inside. That's why you do more backward.
My logic.
It's okay, you have to just understand this is how it is done, and in the physiotherapy also that's how they do. They just relax the muscle so that this thing which has projected outside, it should go inside. That's it. That's how they work on
So
it.
the backwards are good at the end of the day.
When sciatica you have, backwards are good, but when you have sciatica, forwards are not good.
But the sciatica at the end of the day comes because of the lower, the prolapse of the
No,
lower
it is just one of the reason. It can be one of the
back.
reason.
In this case, I mean, it's if you got, because that is because you back, the lower back pain as well,
Yeah.
right?
Yeah, it can be one of the reason I said. It can be maybe because of not the disc prolapse, it can be because of some other reason. I said no, this thing gets completely degenerated and there is no space in between.
But now I'm just talking about the low back pain.
Yeah.
So if you have a low back pain, is it good anyway to do the backwards? The backwards.
If you have lower back pain, I want to know the reason first. What is the reason for lower back pain?
But when you go backwards, you always have to go forward as well.
If you are doing balancing poses for the stress, then it's fine. But main for the muscles, you have to activate the muscles here because it's very physiological, and stress also increases it. But then more than that, you have the lifestyle. It is a lifestyle disorder. More sitting, more biking. You know, you drive bike a lot. You have this up and downs there, hills and all those things causes more problem with the sciatica. So you have to work on the lifestyle. The people who are doing like prolonged one, they have to work on their physiology more.
Okay. So contraindication is forward bend. Is there other contraindications?
Contraindication, and you have to see if in some position they have needling pain, you have to stop that as well. The best is backward bending, strengthening, core strengthening, lengthening. So tell me a few asanas regarding this.
Sphinx maybe.
Very good.
Softer.
Bhujangasana is very good. Then Chakrasana. Again, Chakrasana, if disc prolapse is very severe, you cannot do all this back bending. Okay, I'm just telling, if you have a just disc prolapse or sciatica or just like you have just small back pain or scoliosis or this kind of things, the best back bending. Okay, if it is too severe, like for example your disc prolapse completely came out, it is verge of, you cannot even move your body because it cannot push it inside, then it's completely gone.
With Bhujangasana, you can adjust it so it's
Yeah.
not too intense. Maybe like more like Sphinx.
So it also depends on the patient up to what they can do. According to that, you can identify the severity. Okay, yeah. Then
So Shalabhasana.
Shalabhasana, very good. Then
And then I don't know, because all are many backward bends are intense. Like even in Ustrasana.
yeah,
is
Ustrasana,
But it's intense, no?
very intense.
But it's, I don't know.
So I told it's completely no. The people normally they come, they are able to walk, they don't have radiating pain, they are not into a highly neurosuppressant. It's better to do the back bending and the strengthening.
Yes, even then.
We design it with Bhujangasana, Shalabhasana, then no. No, Matsyendrasana is advanced one. Vakrasana, very good. Then Marichasana, very good. Then Bharadwajasana. Then sciatica, the best is Parshava Sahita Supta Pada Angushthasana. How it is done? When you sleep in the sleeping position, because it's a supta, then Parshava, you take Uttita Pada Angushthasana, Parshava Pada Angushthasana in
But sleeping, lying
the
down.
standing, right? In the same way, you do it in the lying position. Parshava Supta. Lot of sciatical problems are
Twisting.
not twisting. It's the same. Same leg you are bringing to the right side, left side. He'll make you do today. Okay? It's very good. Then Dhanurasana, Salbhashana. Then the upraising, legs upraising, like Padangushta, Padotana. When you raise. Yesterday we did one more thing, no? What is that? Holding, holding, holding. What is that? Supta Padangushthasana, right? We did it, right? Then, yeah. Then the lengthening one. Tell me few lengthening one. Ustrasana is very good, but
Uttanasana we can do also, because it's like soft backward
yes,
bending
whatever.
and lengthening.
What is that?
Asta Uttanasana.
Oh, Parivritta. Parivritta, okay.
There's some
Just
salutation.
Okay.
when we
Okay, might be, but oh, hasta, okay.
yeah.
And then Parivritta Tadasana. Parivritta Tadasana.
Yeah. Which pose?
English.
Which pose? Bridge.
Bridge pose. Setu Bandhasana, very good for the spine, yeah. Then you can write it. Setu Bandhasana. Then Halasana is very good for stretching the entire spine. Then, okay. Uttitta Padotana. Uttitta Padotana. Where you the opposite of Sarvangasana, where you just make the spine in this way. After Sarvangasana, when you do Padotana, Uttitta Padottanasana it is called as, right? Where you just sleep over and you make a bridge, you rest your crown, this is your head, and then you raise. No, that Padottanasana is this. When you lie down and just raising your hands, raising your legs, that is Padotana. You are lying down and you are raising your legs, that is Padotana.
Okay.
Right?
Okay.
Utthita is when patient you can only give Bhujangasana, Vakrasana, Parivritta Tadasana and Shalabhasana. That's it. Dhanurasana max off. That's it. Nothing else. This is all for the spines. Done? Then Surya Vedana, then Bhastrika for Tridoshas balancing. Then Brahmari for the stress reduction. Then
Varun said Ujjayi.
Ujjayi can be given, but it's basically for kapha. So yeah, you can affect the kapha also. Ujjayi can be given for just because it induces the adipose tissue in the wherever you have the synovial fluid problem. You have to increase the kapha there, like you have to balance the kapha there. So for that Ujjayi will be helpful. You have to increase the fat deposition there. Basically, whenever you have this bone problem, you have to give more lubrication. So whenever you have to increase, you can introduce all the kapha things which increases.
Okay.
Then the mudra and bandha, viprita karni you can give if the patient is able to do. Then shanmukhi for reducing the stress, right? And then bandhas, which bandhas you can apply? You can apply 3 bandhas. If cervical spondylitis, the kumbhaka should not, this jalandhara should not be given. But kumbhaka can be given, outer kumbhaka. like Bahya Kumbhaka, not inter. Okay, then the last one is meditation. Yeah, meditation, if it is severe sciatica, the person cannot fold their legs. Okay, they have to do it straight leg. This is very much important. In sciatica, people cannot sit with closed legs.
They feel like they can.
No, they should not sit. If they have
Okay,
severe
so-
sciatica, they cannot sit,
So
they should
it's
not sit.
Another contraindication.
Yeah. So they can do it in open,
If severe, do not bend.
yeah,
the knees.
legs.
Or sit on a chair.
They can sit on the chair.
Okay.
And Shavasana is best. Shavasana 1, 2 can be given. Because it's very, joints one by one, you can make them relax.
And maybe there is better to put like a cushion under the knees. So it's
Yeah, and in some,
lower back.
for example, scoliosis, you have to put, you cannot make them, for them Makarasana is better. They cannot lay down directly. Few have to put the, if you have to, yeah, one more thing I forgot, very important. Anantasana, Paryankasana. In asanas, you have to write Paryankasana. Paryankasana is leg raising. If a person has sciatica, when they are raising the legs in this direction, like this we raise, right? They will have a problem radiating.
You mean in the side?
Sides. They will have a problem radiating to the spine. But when the person is, that is also a test, a treatment diagnosis. Okay. If the person is not having pain, the sciatica is not that severe. Okay. But the Paryankasana is very good for sciatica patient. Whenever you are opening the pelvic, whichever asanas you are opening the pelvic, because it is related to the sciatica nerve, it is very good.
So we can also do all the Baddha
Pelvic, yes,
Konasana
yes. If it is for not forward bending, because for
Yeah,
example,
just as-
all the
but
opening,
then-
if you are bending forward, then it is not
But
good.
then we are bending the knees when we do Baddha Konasana.
That's what I said. If it is not bending, you should not bend forward further.
Yeah, but you also said if there is it's okay,
Pelvic
if there is
opening.
Severe, okay, I'm mixing. Severe, you cannot bend the knees. Normal conditions, you can bend the knees. You can sit in.
There are severity
Yeah, okay.
stages.
Yeah,
If they are not able to bend the knees, you will not ask them to bend.
Yeah.
Okay, but all the pelvic opening is good for them. If they are able to do, let them do. Forward bending, Baddha Konasana or Uttita Padangushtasana, if they are bending forward, it's better not to do. Just the pelvic stretch is enough. In Anantasana, you will give the pelvic stretch, but you are not bending forward. So these are the best asanas. Supta Padangushtasana also, Parshava Sahita Supta, you are not bending. You are lying down and just bending the, opening the pelvic. That is very good. So this is why this becomes good. In Shavasana, few people cannot lie down straight. For them, you have to make the comfortability. Either if they are not able to lie down, make them in the Makarasana. And if they are able to lie down, but not, they cannot, they need some support, you can keep some pillow or something onto their head or onto their back. And make them sleep, and do in their vertebral column, you have to do the Shavasana, like relax one by one. All the vertebrae, they have to concentrate and relax. It's very good for them. So over with the sciatica. So mainly we cannot cure sciatica, but we can work on the muscles around it to make it strong.
And we can do